Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I want to do a primer on SIBO, kind of an overview of what that is. So SIBO is super common. It stands for Small Intestinal Bacterial Overgrowth. I hadn't heard of it until just a few years ago, which is interesting because it is super common. So when it comes to the gut, there's kind of like 7 categories of main pathologies. So that is hypochlorhydria, which is kind of related to SIBO, which just means low stomach acid. There's SIBO itself, and those tend to go hand in hand. There's infections such as parasites and bacteria. There is dysbiosis and fungal overgrowth. There's food intolerances, intestinal permeability, and of course autoimmunity. I will probably end up podcasting on all these topics eventually, so if you guys have something specific you want me to talk about, please reach out to me. But today we're going to kind of laser focus in on SIBO, what it is, what causes it, some symptoms, and what to do about it. Okay, so again, SIBO stands for Small Intestinal Bacterial Overgrowth. So the small intestine is, in the terms of digestion, food goes to your stomach, then it makes its way into the small intestine, where there are normally a small amount of bacteria. And once they become overpopulated, then they can cause some issues. So first, what are some risk factors of developing SIBO? It can be a poor diet, maybe the number one thing, low stomach acid or hypochlorhydria, which is probably what I'll spend a little more time talking about. We'll get back to that. Antibiotic use, things like acid-suppressing drugs, and then impaired function of the MMC, which is the migrating motor complex. So in other words, how long does it take food to go from mouth to anus? That's your MMC, migrating motor complex. Constipation, gut infections, and structural abnormalities of the GI tract, and immune dysfunction. When it comes to the gut, it gets really complicated because one can cause the other and vice versa, and things become compounded. So it's kind of hard to figure out what caused what, but at the end of the day, you just treat it all. So probably the most common reason for development of SIBO is low stomach acid. So as we age, we tend to develop, or we tend to produce less stomach acid. And then, if someone has GERD or reflux, they tend to take PPIs and antacids. PPI use is super common. That was only supposed to be cleared for 2 weeks of use because it's a known issue. But it's over the counter now. So, and when things are over the counter, people tend to think that they're, totally safe. And that's not always the case. And here's one a perfect example. Chronically using that will drop your stomach acid to 0, and then you just don't digest your food. You need acid to digest your food. If not, it goes into your small intestine undigested, and then what happens is you've just fed a huge meal to the small colonization of bacteria, and then they proliferate like crazy, and then they produce gases, and those gases increase your abdominal pressure, which in turn causes the LES, the lower esophageal sphincter, to inappropriately open, and then you get regurgitation of acid, and that's what causes the reflux. So it's a little counterintuitive and probably opposite of what you've been told or heard about, that too much acid in diet causes reflux. Well, what I'm telling you is if your acid is too low, you have this whole cascade of things that happen and can also cause reflux. So when you have this scenario, some things can happen, such as poor absorption of proteins, fats, carbs. You'll tend to feel really full after a meal. You'll tend to belch or have a lot of flatulence after a meal. Certain things will show up on blood work consistently, particularly B12 deficiency that gets gobbled up in the small intestine. So you don't get it, your bacteria does. This can lead to intestinal permeability, or if you've heard of leaky gut, that's sort of the new term for leaky gut, which then in turn can cause autoimmune disease. So this can be a trigger for autoimmunity. I also just want to talk a bit about the impaired mobility, or motility, I should say, of the migraine motor complex, because it's relevant currently. I just did a podcast. The last podcast I did was on how GLP-1 agonists work. So things like semaglutide, Wegovy, tirzepatide, those are GLP-1 agonists. So although people are getting a lot of success with the weight loss with them, one of the things that it does is it slows down the MMC. And that's part of the reason people feel satiated, because the food's just moving slowly through the motor complex. But, as we just discussed, that can create SIBO. And there is, if you start to look online, just type in, is there a correlation between SIBO and semaglutide use? The answer is yes. Oh, and I forgot to mention one of the hallmark signs and symptoms of SIBO, and that's either diarrhea or constipation, or going back and forth from diarrhea to constipation. That has to do with the gases that are produced by the bacteria. So there is something called a SIBO breath test, where you drink a solution of lactulose or glucose, and then we measure the gases produced from your breath. And from that, you can tell what gases are being produced. You can tell what type of species of bacteria you have, and that tells us how to go about treating the symptoms and getting you on the right diet. But before I would do that, I would probably recommend doing a baking soda test. It's really safe, really easy to do. It's free, as long as you have baking soda. So I guess it costs the cost of whatever baking soda is. So it's simple. I recorded a video on it recently. I'll post that in the show notes. Basically, you just drink a solution of water and a quarter teaspoon of baking soda. And it's just like that science experiment in high school where you add bicarbonate to acetic acid or vinegar, and you get that eruption of a volcano. You're basically doing that inside your gut, your stomach. And what you're doing is timing how long it takes to belch after drinking it. So if it takes 2 to 3 minutes, it's kind of considered normal, and you probably have normal stomach acid. If it takes longer, like 5 minutes or greater, chances are you have low stomach acid, which is a pretty good indicator that you may have SIBO as well. So if you run that test and you take 5 or 6 minutes to belch, definitely follow up with a healthcare practitioner, particularly functional medicine, and they can do further testing to find out what's going on. So what do we do if we find that you do have SIBO? There's certain specific antibiotics that you may have to take, just depending on what we see. Prebiotics and probiotics would also help, and then following a low FODMAP diet or reducing the intake of certain fermentable carbs, that can also help reduce the symptoms. And then it really comes down to managing the underlying conditions. So if, probably the most common is the low stomach acid. So if you do have some symptoms of bloating, abdominal pain, some irregular bowel movements, diarrhea, constipation, give us a call and we'll get you started on the right path. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.